Hi, my name is Dave Page, and I am the director of the Pre-Hospital Care Research Forum at UCLA and a paramedic at Allina Health EMS here in Minneapolis, St. Paul, Minnesota. I'm also the route coordinator, the co-coordinator for the 2016 Midwest National EMS Memorial Bike Ride. And this informational webinar is intended to inform potential participants and potential volunteers, support staff, or maybe even agencies that might want to sponsor and assist us through this particular effort. The bike ride will take place June 25th through 30th. We actually will begin from the city of Northbrook, Illinois, and finish in Woodbury, Minnesota, a suburb of St. Paul. And we can get down to the specifics of the route here in a second. This is a very special effort, and we want to make sure that you understand what the EMS Memorial Bike Ride is all about. And with that spirit, I'd like to just kind of share the mission of the EMS Memorial Bike Ride. And that is that we honor emergency medical services personnel by organizing and implementing long-distance cycling events that memorialize and celebrate the lives of those who serve every day, those who have become sick or injured while performing their duties, and those who have died in the line of duty. And I really want to emphasize here that we want to not only remember, but really celebrate the lives of those who've given so much to emergency medical services. It is, I think, key that in a job that's so dangerous and fraught with a lot of safety issues and low pay, that the public and our own community understand why and how it is that those of us that came before have sacrificed so much. And obviously, line of duty death is our primary, most important focus. But we also want to make sure that we, even for those deaths that can't be directly attributed to a line of duty death, something like a cancer or other illness that was never actually linked directly to an on-the-job injury or work, but still represent a significant component of the losses that we do experience, and particularly of people who've given 30, sometimes more than 30 years of experience in their efforts towards emergency medical services and towards the community, that we don't forget those people either. It's often that we will honor someone who is an EMS provider who's died overseas while in combat, and in some cases honor people who died of natural causes, but again were great contributors to emergency medical services in those communities. Our vision is to see recognition of EMS as a profession, a reduction in debilitating injuries and line of duty deaths, and a national EMS accountability system. It's our hope that these events will focus attention on the accomplishments of EMS personnel and educate the community at large about the need for improvement of safety standards, injury prevention, disability tracking, and death benefits for EMS personnel and their families. We really focus in on remembering EMS workers who've died in the line of duty. That's our number one priority. But part of the bike ride is a bit of marketing, I guess, raising public awareness and informing people of those line of duty deaths. I guess I shouldn't really call it marketing. It's not that. It's more an awareness and a desire to communicate with our community. We want to honor those EMS workers who continue to work despite our dangerous safety conditions, and advocate for national tracking of those injuries. We also really focus on safety. So we want to provide a safe and friendly environment for all individuals to participate in our events and promote healthy lifestyles for EMS providers through physical activity, nutrition, and also positive mental health. I can't emphasize enough how much the community is behind this and how much this event builds the community. What you see are images here of various rides. I've been involved in the ride since 2007, but the ride started in 2001 after the September 11th horrific disasters and the attacks. A group of cyclists wanted to bike down from Boston to DC to raise awareness about what had happened on September 11th. And until 2007, it was a very small group. In 2007, it grew, and we slowly became a nonprofit entity. And our purpose with our fundraising has been to help the families of those who've lost so much. The bike ride is a thread that you can think of as a catalyst or a lightning rod to create a series of moments that we feel we can remember and honor those people who we've lost. So whether it's a send-off, here you see a picture of Congressman Fitzpatrick's send-off in Pennsylvania in 2012, or the arrival of the bikers in a particular city or town where we read the names of those who have died. We try to support each other and try to actually plan the route through cities where there have been significant losses that year. And in this particular case, we'll be biking from Northbrook up towards Milwaukee. There was a series of people we've lost in that corridor, but we'll go on to Green Bay, and they, of course, suffered a tremendous loss, which is unfortunate. So we've wanted to connect the dots, if you will, between the places where people were from or lived or worked, so that their families know that we really care and we will never forget. One of the things we do is make sure that we carry with us the names of those that have died in this year. And some of us have dog tags from years past as well that we carry every year. So the dog tags help us focus even when our muscles are sore and our legs are tired and we don't, our rear end is sore, to actually continue and think about them and really honor them. What we try to do is give the dog tags to the families on the last day of the ride or at the memorial service. There's a National EMS Memorial Service occurring in May in Washington, D.C., and that will be one of the places in which we will make sure we honor and connect with the families of those who've lost someone. Bikers take all sorts of opportunities to put the names on the bicycles, on their jerseys, on their sleeves, just to make sure that people know why we're riding. And they also are read at each one of the stops. We have posters that you will see in a future photograph here. We create posters that we put up at rest stops or at events, detailing the history and what person we're honoring, what their contributions were. We tend to ride single file, and in parade format, we take routes that, especially in the countryside, that are not traveled much by cars. But we also try to, at least where possible, and with the support of law enforcement and the right permits if required or necessary, bike in cities to, again, raise awareness. So that does mean that emergency vehicles join our procession, and many times we have them at the side of the road. when we're biking by, particularly at locations where there have been ambulance crashes or deaths. But we also have this notion that procession, that parade, shows the families that we as a community care, and it's not just EMS personnel. So you don't have to be an EMS provider to ride in the EMS Memorial Bike Ride or to volunteer to participate in all ways. We often have family members and friends that just participate, and we think it's a great way for people to contribute. Rest stops are extremely helpful. That is something that we try to plan rest stops about every 10 to 20 miles with food and bathrooms. But these are also places where we are able to remember the people that we are honoring and celebrate parts of their lives, whether they worked at that station or perhaps we try to use fire stations, ambulance bases, and police departments, hospitals, anywhere that we interface to actually create these rest stops. We try to keep costs to the minimum, so we use facilities, especially bathrooms, that are already in existence instead of trying to or having to pay for porta potties. We want to try really to save as much money as possible to help those families. These are very emotional stops, and people go all out in some cases to ensure that we have the support that we need. Oftentimes, local agencies will help us mark the route and actually stand guard or help us with safety at intersections or places where the bikers might get confused about where to turn. So if you're listening and you are part of an agency that would want to assist, or friends, family, or are simply a cyclist that wants to support the effort, we'd really love for you to join us. The details for this year, we're leaving from Northbrook, and we leave on June 26th. So there's an orientation the night before on the 25th from 6 to 8 p.m. And we will be working there with the Northbrook Fire Department. The orientation the night before is at the hotel, and once you register, you get the hotel list. If you would like to camp, that's on your own. You can figure that out, but we have made reservations and room blocks for hotels all along the route in the cities that we're going. And at this stage, in May, the route isn't 100% confirmed because we're still confirming who can assist us with rest stops and support us that way. So if you have knowledge of routes and cycling options, but more importantly, if you have line of duty deaths that you want to make sure we celebrate or that we celebrate the people who died in line of duty death, that you inform us, and we can actually make sure that we incorporate that into the route. We leave at 7 a.m. every day, and we are going to go up the shore as much as possible, hugging the shore. I've got a little map here in a second, but we'll go on day one from Northbrook to Milwaukee. That's about 80 miles. And then Milwaukee to Green Bay, and that'll be another 80 to 100 miles. We have SAG wagons, so if SAG supporting gear, so your luggage is transported for you, and someone is able to give you a ride if you get too tired or have a mechanical breakdown. We usually have a mechanic with us, and if not, we can get to a bike shop that can assist us. If you know of a bike shop that wants to support us and have repairs right on site, that's even better. But we kind of scrounge around and do what EMS providers do very well, which is make whatever we can available work, and then ask for support and get to support where we need it. We'll go from Green Bay to Oshkosh, Wisconsin, and actually we'll shuttle riders from Oshkosh to La Crosse, Wisconsin, which is the end of day 3. And that's because we need to get to La Crosse due to a crash that occurred there, and want to ensure that we it's a doable distance. So that day, from Green Bay to Oshkosh will be around 50 to 70 miles, not a very challenging day by any means, but I think it'll be meaningful, again, due to the scenery, and it's beautiful in that area, and beautiful in most of Wisconsin. And we want to enjoy the biking as much as possible, but wanted to get to Green Bay and wanted to get to La Crosse. So we'll load up cyclists in Oshkosh, take them to La Crosse. From La Crosse, we will bike on the Wisconsin side for a little while, and then on the Minnesota side up to Lake City, Minnesota, where there have been 2 tragic deaths with public safety personnel, and some very recent. Finally, from Lake City, we'll go to Woodbury, passing through Ellsworth and River Falls, then up into Hudson, and finally into a final parade procession from Fox Run Fire Station. If you have an emergency vehicle and would like to participate, let us know. Please communicate directly with us, and we can let you know. But staging will occur at that station by 2:30 p.m. Eventually, the ceremony will be at 3:30 p.m. With a prompt start at the Woodbury Public Safety Memorial in Woodbury, 2100 Radio Drive. Everyone is invited to that, cyclists or not, and we will hopefully form a sea of blue, as we call it, to ensure that this is a Class A event, and have people in uniform demonstrating to the families and the media and our community that we actually care deeply about those who've gone before us and that we won't forget them. This is what the map looks like. Just that's not the actual route. We'll try to hug the coast as much as possible. This is the recommended Google cycling route, but we know we'll have rest stops along the way through Kenosha, Racine, and up into Milwaukee, then continuing on up in towards Sheboygan, maybe even Manitowoc, and enter up towards Green Bay, more towards the shore. Day 4 and 5 now, Lake City, Minnesota, returning to, La Crosse first, and then up into Lake City. And you can see the route here. We will, I'm sure, have a rest stop in Wabasha, and intend to do something special there at some point. There are also events that we do where we have overnights, and so depending on what people want to do to host us, we can do that as well. We follow an incident command structure to manage the ride. Everybody knows how it works because we're all EMS providers. Todd Johnson from Woodbury Public Safety is going to be the ride command, and we'll operate the very same way that planning and logistics and operations, all of those pieces work to make a ride possible. Not much to be said other than some cities use this entire day as an incident command exercise and a communication, interagency telecommunication exercise. So they declare a disaster drill and use state resources to see if radios will work between agencies to manage an event that's moving. So instead of a tornado, we're just a bike ride, although sometimes it feels like it's a tornado. But we are moving disaster to be a drill, if you so choose. Registration is $50 a day, up to $200. Once you hit the 200 mark, it's all of our rides end up being $200 as a minimum, and then a $50 per day minimum fundraising. So additional donations are highly encouraged. We want to try and get kids from people who died in the line of duty educational money to continue their studies, and so any kind of extra fundraising obviously is great. We try to keep our initial registration low so that it's affordable for EMS providers who are not necessarily the most wealthy people. And everybody gets a t-shirt, but if you want a jersey, then we really want to know from you soon. We have to order those. They take a month to come, and so May 25th is the cutoff to get a jersey by the day of the ride. But it is quite possible that you would be able to get a jersey or order a jersey that would arrive after the ride as well. Volunteers who are not cyclists can assist and register for a $20 fee. So that's just to cover our costs for their t-shirt and a couple of other things. They're also encouraged to fundraise, so people are welcome to, and we hope they will. But at minimum, we would appreciate that just to get us moving. Sometimes agencies will assist us in local jurisdictions if you have people who are if a school, a paramedic program, an EMT class wants to help us with a rest stop, we don't have everybody register at that point. That's an agency that's functioning under their own insurance, et cetera. They're just under their personal insurance. I want to talk a little bit more about the Fallen Angels Fund. This is Stephanie Calloway, who's a paramedic in Delaware. We rode through Sussex County in 2009 and celebrated her life. I just want to say that it was an incredible honor to have Matthew bicycle with us, and he was young and eager and led us on the last leg of a 100-mile journey that day. And that's really who we think about. That's who we want to honor is the people who really have made that such a sacrifice. I would like to be able to say that there's money in that Fallen Angels Fund for Matthew to attend college or get some sort of professional training, or be able to assist the families in such a way that they can move forward without their, in some cases, breadwinner, and in some cases, key member of their family. So that's really what we're all about. We have great fond memories that year of so many EMS providers and their families, but I can't tell the story without saying that Stephanie was very special in Delaware, and we, upon arrival in her hometown, went around the circle in the main square of town in the opposite direction, because she always used to make that error or intentionally do it in the ambulance, and so everybody remembers her going around the circle in the wrong direction. So the cyclists went around the circle in the wrong direction. So it can be fun and it can be special. Again, focusing on the positive things that people have done. In Minnesota in 2015, we had 80 participants in this ride. And now that it's going to be a Midwest 2016 ride, we'd love to have more. The local agencies here really supported us, and we want to see that grow to our Wisconsin and Illinois contingent and friends and family. We really think of EMS folks, police, fire, and EMS as a family, and we want all of our family throughout Illinois, Wisconsin, and throughout the Midwest to join in this initial Minnesota effort. So please get more information either at muddyangels.org. You can contact me directly. I'm the route coordinator, again, Dave Page, and my email address is dpage@emsed.org, What was I saying? Thank you. So dpage@emsed.net, and my cell phone number is 651-705-6505. So I hope that you register. I hope to hear from you. If you can assist us in logistics, and look forward to meeting up with you and doing something great.